Welcome to Research Matters, the podcast where we discuss research matters and why they matter. My name is Joshua Davis with the Office of Research at Kennesaw State University. Today, we're exploring how KSU researchers are transforming the future of healthcare through innovation and collaboration. Within the Wellstar College of Health and Human Services, faculty and students work closely with regional healthcare partners to develop solutions that improve patient care. One recent initiative focuses on easing the strain on hospital staff by introducing technology that streamlines the patient screening process. Our first guest today is Dr. Sweta Sneha, faculty researcher at KSU, whose work centers on healthcare systems and digital innovation. Through a collaboration with Wellstar, Dr. Sneha helped implement a virtual health aide across several hospitals to improve patient flow and reduce the burden on nurses and clinical teams. She joins us to share how this technology works, the impact it's having, and what it means for the future of care. Joining Sweta today is Susan Thurman, the VP of Patient Services and Chief Nursing Officer at Wellstar Health System. Susan and Sweta work together to develop and implement the virtual health aide. So, Sweta, thanks for being here. And can you please give us a brief introduction of who you are and why you're here?
My name is Sweta Sneha. I am the founding executive director of Healthcare Management and Informatics. And in that capacity, I work heavily with the industry in understanding where the gaps are in innovation in the everyday delivery and practice of healthcare. And we bring those experiences back to our faculty and our students. And that's the most joyous part of my job.
That's beautiful. Where did you come from?
So I actually was working with PricewaterhouseCoopers in management consulting prior to coming back to academia. And what pivoted my journey was the first IOM report that was published in late 1990s.
You said
It's the Institute of Medicine.
Okay.
And that first report, it read, "To err is human. It has made history in more ways than one." And it was the report that essentially pointed out to the fact that we have close to 100,000 deaths in the United States alone due to preventable medical errors. One of the biggest reasons why that report made a big difference was because when I was working with PwC, I was working with large organizations, really trying to understand their processes and workflows and how things work, how they can improve efficiency and workflows, reduce cost, improve their employees' lifestyle and experiences, and so on and so forth. Well, healthcare was going through a similar crisis in more ways than one. And there was this incident at Johns Hopkins that really shook me to the core, where there was this pediatric patient, Hosie King, who was admitted at Johns Hopkins, one of the best health systems in the world, not just in the United States. And she was admitted for burn injuries. She got better at the pediatric ICU. She was being transferred for 24 hours observation to the general ward before she was to be released. Hosie passed away due to dehydration in Johns Hopkins. Completely unacceptable. Definitely unacceptable at Johns Hopkins. Dehydration is a third world condition. It cannot happen at Johns Hopkins. And it did not happen because the physicians were not committed. It did not happen because the nurses were not committed. It happened because of a lapse in communication. And since then, Johns Hopkins has made strides in improving patient outcomes and improving patient experiences. And the number of deaths due to errors, preventable or not, has come down significantly.
So let's introduce Susan. Because Sweta, so how did you meet Susan, and who is Susan?
My name's Susan Thurman. I'm the Vice President of Nursing at Wellstar Health System. Sweta and I paths crossed several years ago while we were, and I'll just go back to what you said about quality, while we were working together in research to solve complicated issues in healthcare.
Okay. And
our paths crossed, and we've been working together ever since.
Absolutely. And you know how small meetings led to big changes and lead to professional relationships that actually turn into friendships over the years. So Susan and I met, I have to say it was back in 2011, 12, about a decade back. And it was over several lunch meetings that we both agreed that we could help each other. Back in 2010, 11, that was the time frame when Atlanta had sort of plateaued in terms of workforce and economic dev. And when we were looking at the healthcare landscape, we realized that was one area, especially digital health, that was leading and growing by more than a mile. And there was a gap in workforce dev. There were no programs in the university system of Georgia
Really?
that was producing students with the informatics skills that was required to fill in those gaps as digital and electronic health records and e-prescriptions were becoming more central to the everyday delivery in practice. So right now, whether you're a Wellstar or an Emory or a Piedmont or a small startup or somewhere in rural Georgia, every health system is sitting on a mountain of data. And you can leverage that data to hit the 4 aspects of quadruple aim. So you can improve cost, improve patient outcomes, improve provider experiences, and improve population health. And all 4 are so heavily driven by what digital health can do.
Everyone that works in healthcare, whether you're a nurse or not, you want to make a difference. You want to ensure that your patients are receiving great care. No one goes to the hospital to be hurt.
Right.
They go to get better. And when you were talking about the IOM, it was really a call to action. It was that
For the entire industry?
For the entire industry, not only in hospitals and healthcare, but other professions like digital health. And what I would say to that call to action is the preventable medical errors. You want to take out the human factor, right? Because humans make errors. And that's what was highlighted in that report, and that there's systemic failures in healthcare that makes it easier for the human factor to come forward.
So, Sweta, come back to the virtual. So talk to us about this platform.
Right. So we kind of started talking about it before COVID, but during COVID, it became apparent to us that how we can leverage some of the nurses who are leaving the workforce. So just to walk you through what a patient experiences. So from the point of admission to the point of discharge, there is a whole bunch of things that happens with the patient, and let's call it patient experience. Then there are patient outcomes. Patient outcomes are associated with those experiences as they're moving from point A to point B throughout that journey. And then at the point of discharge, we want to make sure that when they're leaving Wellstar, for instance, that they know, A, what is going on with the condition. How can they make sure that they can stay outside of the health system, yet stay healthy? They know how to follow up. They know what to look for in case things are going wrong. And a lot of that information is relayed to them at the point of discharge by the nurses on the foot.
Oh, that's interesting. Yeah.
Yes.
So the nurses, I never really thought about how much of a communication mechanism, but the nurses are crucial.
Yep. And these are also the nurses who are already stretched to capacity, who are already working sometimes 60 to 70 hours a week. So, but then we had these steady growing population of nurses who did not want to be on the bedside anymore, but were still very eager to be part of the health systems and be able to contribute to improving patient outcomes. So as we were talking about it, we thought, well, how about we kind of play with the idea of putting screens on the bedside, and we can have one nurse who's going to be virtual the entire time, but that one nurse is going to be associated with you, literally joined at your hips.
Almost like a client success is what I think of an industry. Like I'm assigned to help you be successful and communicate.
Exactly. From the time of admission to the point of discharge and beyond that. So that allowed Susan to manage the nurses who were on the foot a lot more efficiently, and also leverage the nursing capabilities of people who had left.
What did you call this?
It's a virtual nurse platform.
So help me understand this. So what I recognize that the medical industry, you guys are always researching research. Like what has someone else discovered? What else has someone learned so that I can turn it into an outcome? How does innovation and research connect? And then you, as someone who's a practitioner, why do you connect with the Sweta?
That's a great question. And I'll tell you, in my mind, there's two different researches, right? There's one that's innovation, it's new research. It's research design, it's looking at systematic data, how do you pull it, what are the problems that you're trying to solve for? That's the new research. And then you have established research, but you're wanting to validate that, right? It's the amount of research that's out there. So when you go back to the IOM report, I just wanted to mention, because it's so important and linking it back to research, it's all about problem solving, right? It's all about that call to action. But I will say that I always think this is staggering, that in the United States, the third leading cause of death is preventable medical errors. Second to cancer, and the first one being heart disease. So that is a sobering fact, right? That is one of those things that not everyone knows.
So take us through this.
Yeah.
Take us through, I'm a patient. I go to Paulding because I cut my arm off. All right. So take me through, what is my experience going to be now with this virtual nurse? So take me through the experience. What do I see different?
I will start from the opposite end. So I'll start from what's going to happen at the point of discharge.
Okay.
So at the point of discharge, now you've spent X number of days. Your length of stay was determined at the point of entry, and you spent, say for instance, you spent a week.
Okay.
And at the end of that week, now you're healing. Now you just need to make sure that you continue healing, and you can get out of the health system. You can go back to your home, and you still continue following it. Now, how do you know what are the things that you need to do? Because now you're not going to be visited by a nurse every single day, multiple times during the day. So you need to understand what you need to do to make sure that your healing continues in the right direction. And that you also know what to look out for in terms of complications. You know what medications you have to take. You understand if you don't take those medications, what's going to happen. You understand what you should or should not do physiologically. Don't go out to the ball game and start throwing balls, for instance. So at the point of discharge, a lot of those information is communicated.
How?
Initially, it used to be through the nurses who are on the floor. And I will let Susan talk a little bit more about it because she lives it every single day. But now with the virtual nurse, now there is a nurse whose entire job, not having to run around, get physicians, get other things.
They're at a command center. They're at a command center, and what I'm seeing too, it's almost like it's an account representative. I have someone who's been assigned to me to track me through my entire journey in the Wellstar system.
Absolutely. I mean,
It's almost like a virtual assistant is what I feel like.
That's what I was looking for. Virtual assistant.
That's right.
Okay.
That's right.
But it has a human attached to it. It's not an AI. It's not a chatbot.
Absolutely. Now, I'll just mention what Sweta said is, to be successful as a patient, you have to have the right communication.
Wow.
And when you're in the hospital, the nurses are very busy and they carry cell phones just like we do, right? We want to be available. So your phone rings all the time and it's distracting.
Yes.
And so our patients want and need that one-on-one time. So back with COVID, one of the things that we learned that was something we would have never thought about before is we used iPads, tablets, to talk to the patient's family, because at that time, of course, family members were not allowed in the hospital, which was very, very difficult for nurses, families, and patients. But we would use iPads and call the families to give them an update or let the patient talk to their family, right? So that's when, and linking it back to the previous conversations and kind of in the concept phase, if you will.
So it did happen. This idea happened right at COVID together?
Yeah, it did, because what had happened, we had already had a relationship before COVID, but the virtual nursing component of it, because we learned during COVID that we used technology to talk to our patients in a different way.
But I love it too if you look at kind of a crisis at the beginning of sort of both of y'all's motivation to go into this and really help change the space. And now another crisis pops up in a different way that motivates innovation.
Right. And I'll link it back to research for a minute, because when you were talking, I was thinking research is about knowledge and sharing the knowledge, right? There's a process behind it, of course, right? But for virtual nursing, we wanted to try something different because we had a little bit of information of how digital technology could help us communicate. And we also knew and know that we have a healthcare workforce issue, not only nursing, but now it's much broader than that. And we know nationally for nursing, the nurse vacancy rate is about 30%. So it's pretty high, right? So we know that we need to think of things differently. care model redesign. Care models, what can we do different to support the nurses on the floors that are in person, right? COVID was that kind of moment that we said we could do things differently. I don't think we would have thought about it otherwise, right? And so back to virtual nursing, we have what I would say 4 capabilities.
Okay.
That admission. So during that admission time, you really want to make sure you do a thorough assessment so you know what your patient needs are, right? And then we also support discharge that ensures that your patient is ready to go home and be their best self, but that communication component is very important. There's an education component as well. And then an access, of course, access is another component.
What does that mean?
To ensure that you're getting back to your physician appointments and that we do have access points that's difficult to get into. Have you ever tried to get a doctor's appointment and you have to wait 4 weeks?
Yes, or many months. But
that's
yes.
right. So in ambulatory or the physician space, they've also got virtual technology that you can now do on demand appointments. So it kind of converges to really look at how we can deliver care in a different way and support the success of patients. So that's 2 of the workflows, and 2 more just quickly to add to it is we do medication double checks.
Okay.
Because our technology is phenomenal, and
And double check is
just making sure that you have any high risk medication. We always double check just for the safety, going back to the quality of care, right? But one of the things that happens in practice is if I'm a nurse and I need a medication double checked, I go to look for another nurse and they're busy as well. So if you have a virtual assistant that you can call, they can look at and you have it really quickly.
Okay, so where were you guys seated when you had the idea? Like, were you at a coffee shop? Just,
At
you were at
lunch.
lunch.
Right.
Okay, lunch.
So both Susan and Leanna, as you
Who's
can
Leanna?
imagine.
She's one of our colleagues, Leanna Spiva. She is she works at Wellstar.
She works at Wellstar too.
And she is a researcher. So we're partners.
Okay. So you guys sitting down, chit-chatting about, hey, it's really bad right now.
We were having conversations about healthcare. So Leanna and Susan are the people that I started working with when we launched this program, and we have been working on several projects together. We were having conversations about some of the challenges with patient outcomes and nursing workforce, and some of the challenges with communication. I mean, just to bear in mind, the average literacy rate for most people in U.S. is middle school.
Yes.
And think about the amount of paper that gets given to the patients at the point of discharge. You may read through it, but then to make sense of it is different. So this allows not only to improve that paradigm of care from admission to discharge, but also it allows for a model where you can invite other family members. You can record this conversation that's happening at the point of discharge. You can invite other family members who could then also be associated with that conversation. You can change it because now it's digital. You can change it from English to Spanish to
you can
French
make it audible,
to
where
Arabic.
it's read to you as okay.
It really took that communication and that understanding on steroids and made it easily accessible to patients, or Wellstar would make sure that there is no patient who's leaving their facility who does not understand what they need to do going forward.
So what research was necessary? What had to happen, KSU and your colleagues, to lead to becoming a prototype, probably the appropriate word for Ed Paulding? What had to happen?
So much. So it went over, multiple semesters of work with faculty, with grad students, and it started with simple observations. So think of this as a design science research. And also where it's like an action research where you have faculty and students. And Susan and Leanna and we moved mountains to make sure that our students were able to kind of go and be a fly on the wall. Just to observe
and learn the human systems necessary.
Just to observe, document workflow and processes, document what the big challenges were, document what the opportunities are. Because there's one thing for Susan or Leanna or even the nurses to tell us what is going on. there are nuances that get picked up when you're in that same
Right.
room or when you're in the same floor. And they were very generous with making it happen for our students.
From a nursing perspective, every workflow that the virtual nurse is able to do for you, you can take about 20 minutes, and you can take that 20 minutes and utilize it in a different way. So one of the things I think that's really important when you think about nursing is a 12-hour shift is not a 12-hour shift, right? You still have a lot of things to do before you leave.
Wow.
So if you can take those 20 minutes and a virtual nurse can have that 20 minutes to support that admission, for example, two things happen. One, that bedside nurse that's in person can utilize that time with another patient. Two, the virtual nurse has uninterrupted time with the patient, which is critical because earlier I had stated that the nurse has a phone, right?
Right.
That
And it's constantly.
rings.
I mean, I've been to the hospital before with parents, and it's always like, well, we need to know. And they're running around, they get a phone call, and they got to go to another room. Yes.
That's right. So uninterrupted time. And one of the great things about the technology is you can bring in really 50 people. I say you can have a family reunion, but you can bring in anyone you feel is
like-
necessary.
As long as you check the box that this person's allowed to have the information.
That's exactly right. That's exactly right. And you can bring in other disciplines. Like,
Okay.
for example, you could bring in physical therapy if they
Sure.
needed, have some education, chaplain, that kind of thing. From a patient perspective, what we learned is patient experience goes up. Why does it go up? Because communication is important.
Which relationships, I've been married for 26 years. Communication matters.
Communication matters. It's very important.
It is. And it's active right now. So right now, we might have a few dozen people doing a virtual nursing conversation.
That's right. That's
As
right.
we speak.
Yeah.
Yes.
And you can do anything and everything you want to do. The
Yeah.
possibilities are endless with virtual capabilities.
So how does it make you both feel?
Well, to me, even when I launched the healthcare management informatics program, because the idea was to be plugged in with the industry hand in glove so that we are working very closely to understand the skills that we are giving to our students as they're going through the program is going to be relevant to the industry. So to me, when I see something like this come to fruition and then continue working on projects with our industry partners is when it all comes together. It's very fulfilling, not just to see how it has impacted the community and the ripple effect that it causes on that health system, on that one person, on those 20 people, but also the light that you see in the eyes of the students as they're beginning to see how their learning
Right.
can impact the everyday delivery and practice of healthcare. And then there is the research component. So one of the things that we didn't talk about is how this all gets put together.
Okay.
So, and as you're thinking about research and taking this forward, that process is important. So there's always going to be that one person who's going to start that conversation. But if I'm that liaison that working with the industry,
What role in this project did industry play?
a huge role. I mean, for instance, even if I knew anecdotally that by just studying at research and published research that, not virtual nurse, but nursing shortage is a big problem in the industry, I couldn't have come up with that solution individually. Maybe we would have been able to do something in our labs individually, but to take it to fruition, to bring it to Wellstar, to see its impact grow, to see how the patients are reacting, to see that the patient experience is improving, to see that the nurses' outcomes are improving, the patient outcomes are improving, and the provider experience is improving. We couldn't have done that just sitting in our own little rooms.
And I think the other thing is personalization of healthcare.
That makes sense because it's about the users. Okay, are there any other anecdotes or thoughts that you guys would like to share about your experience, your journey along this path?
It's a wonderful profession. I will say that for sure. But I will also say, just to kind of go back to the student experience, I believe it's a professional responsibility to go back to give back to students.
Okay.
And the great thing about that, and it dovetails with the conversation, they want to have an impact and we want to have an impact. And you want to have it with really important partners that has the same goal in mind, right? So we come together to look at the problems and the issues and the concerns with the students that are current and previous, and look at how we can come together on research and solve those solutions. And sometimes, and you mentioned it earlier, Sweta, sometimes it's semester over semester because there's complicated, complex problems that we're trying to solve.
Exactly.
But the students are very, very important, not only to me, but definitely to Wellstar. And we're, again, I believe it's a professional responsibility that we're always giving back. We were all new at one. I mean, I was a student before multiple times.
We've all been there, right?
We've all been there.
Yes.
Yes.
Well, thank you both so much for your time today. It was wonderful to learn about your research and the impact it's having on patients.
Very good. Thank you.
Thank you.
It's a great time.
Enjoyed
I could talk
every
about
bit
it
of it.
forever. This is what we do
Exactly.
all
Let's say this is over lunch.